Welcome to a day that has been decades in the making. I am Steve Peters, and I'm here today pleased to be your host at the official opening of the St. Joseph's Southwest Centre for Forensic Mental Health. Today we mark a number of milestones long in the making. We celebrate the opening of this light-filled, dignified place of treatment and hope. We pay tribute to the rich history of the former St. Thomas Psychiatric Hospital, more recently known as Regional Mental Health Care St. Thomas. And we come together to renew and recognize our collective commitment to create strong networks of care, education, research, and support, spanning home, community, and hospital.
Excellence in mental health care has a long tradition in the community, and the Southwest Centre for Forensic Mental Health will expand on that tradition. This is such an important part of the continuum of care of mental health options available in London, St. Thomas, and the surrounding area.
I really think it's so fitting that a site with such a rich history is now home to this beautiful center that's ushering in a new approach to mental health services. It's a center that's designed, obviously, just from being here, not just to treat mental health issues, but to promote healing and recovery so that patients can successfully return to their communities, because that is the point.
With so many so hard at work for so many years through times of delay, change, transition, and yes, upheaval, how wonderful it is to be here at this moment. We have held on to a vision for a better future, one that safely affords people care, housing, and support outside of hospital whenever possible. A future free of stigma in schools and workplaces, a future secured by stable investment. This vision of mental health care has been studied, started, stopped, reshaped, and restarted for more than 30 years. There must be shelves of those reports over the years. Now together, we can truly say that this is the time for mental health care, and today marks a major destination point in this journey of care.
I was very pleased to support the naming of the Education Centre here, the library, in honor of Father Desleb. Priests will have a lot of appointments throughout their priesthood, but not Father Ernie. He had one appointment, and it was here. He gave his whole life, almost 50 years, in service to mental health care. He was a true pastor to his patients and to the staff at the hospital. And his ministry, people said, was one of presence. He listened. He listened to people that he came across. He just took time to enter a conversation with them. They all said he had a caring heart.
I was part of the forensic system for 7 years. My first 10 months were spent in jail, followed by a year on the forensic treatment unit and another on the forensic rehabilitation unit. The remainder of my rehabilitation took place in the community. I'm no expert when it comes to rehabilitation, and I don't know the first thing about design, but I know how accommodations make me feel. When I had no window and only a toilet for furniture, when the fluorescent was always, and my company never, I was convinced that not a soul in the world cared about me. When I see this building, I am convinced that the individuals who will pass through here will be cared for on many levels. I hope these surroundings remind them that they are not abandoned or forgotten. When I see this building, I know my community cares about mental illness. When I see this building, I know society has compassion. We are celebrating a new building and change. I am celebrating the dignity we are able to afford the staff and clients who will occupy this facility. Those who suffer from mental illness deserve no less. It has been my painful pleasure to come to know both clients and staff across the way. I have become friends with both. I am pleased that the staff will have surroundings befitting the fine care and expertise they measure. The responsibility we entrust them with deserves our respect. This building fights stigma. When we can all come together and create such a space, it allows us to all understand. We can have no doubt that these illnesses deserve our very best. The line I often saw between mental health and physical health treatment disappears on this site. I've been a mental health consumer for 34 years and have experienced several institutions. Often my will was not to be there. One that sticks out in my mind I only spent a couple of days at, but I can still remember the graffiti on the seclusion room walls, the tired old furniture, even the paint would send any person for the exit. For some of the occupants here, at times, there really isn't an exit. If they can look around themselves and see everything I see in this building, I suspect they will be better able to embrace their rehabilitation. Southwest Centre for Forensic Mental Health Care will further the welfare of those unfortunate enough to find themselves here. These premises are a remedy to preventable hardship. This hospital is more therapeutic than the old one for one simple reason. Patients will have their own rooms. To live in a dormitory, every noise is common and privacy is extinct. Even the mentally ill need a space to call their own. Even the mentally ill need privacy. Even the mentally ill need solitude. No one wants to find themselves in this building. It is only the staff who choose to be here. Mental illness is not a choice, and these facilities should be about rehabilitation. I am pleased for my neighbors and community. I am pleased for the many people I know who suffer from mental illness and for those who don't. To be here is usually something that happens to someone else. There is no inoculation to exclusion from this building. Thankfully, there is treatment, so we can all take a path towards the exit. We are all fortunate to have had this opportunity to consciously and deliberately plan for advancements in rehabilitation and to honor society's shifting perception of mental illness. Thank you.